Hey y'all, I just got off of a shift at the ER, but something is happening right now that we've got to talk about. Y'all have probably heard about the big bad bill that left the Senate and is now moving through the House in Congress right now. And I can tell y'all it is so painful to read the headlines right now while I'm working at the emergency department trying to save lives, because I know how important preventive care is to patients and how important access to care is to patients and how important it is for people to have the coverage that they need through programs like Medicare and Medicaid. Under this bill, if it passes, millions of people are going to lose their coverage or have to pay far more than we already do for their health care. This legislation slashes Medicaid through work requirements and funding cuts, and nonpartisan estimates show that 7.8 million people stand to lose their health care coverage under this Republican bill. The new work requirements alone mean that 4.8 million people are going to lose their Medicaid. This means that parents and kids will lose their doctor visits and their prescriptions, and people in nursing homes will not receive care. It's also really disturbing that 1.6 million people that are currently receiving care for substance use will also lose their coverage, and people in recovery could lose access to their life-saving rehabilitation programs. This big bad bill absolutely puts profits over the health and safety of people. It will drive up premiums and out-of-pocket costs for working and middle-class Americans and Texans. In so many ways, there was life before the Affordable Care Act and life after. I've seen how impactful these programs can be and how it helps people who desperately need care in the emergency room. This big bad bill is a raw deal for American families, and it's going to cause harm if it passes out of Congress. If you have a Republican congressman, you need to reach out to them. Let them know how you feel about this bill. In the meantime, we'll keep fighting for you on the state level and organizing in our communities to make sure that we're electing people who care about the health of seniors, the health of disabled and vulnerable Texans, the health of children and their parents, who understand that everything within us is connected. For our communities to be safe and healthy, every single one of us needs the coverage and the care that we need and deserve. So keep fighting, y'all. Keep organizing. We're going to fight to take care of you.